Hey there, we're talking about anti-aging tips today. So do you have bags under your eyes? Do you have dark circles under your eyes? How about saggy eyelids? If you have any of those and you want to find out the causes, the treatments, and to prevent them, then go ahead and stick around for this video. And if you stick around a little bit later in this video, we will also be discussing some pro tips on how to treat these symptoms of what's called paraorbital aging. So the first signs of aging, unfortunately, is around your eyes. So some of the reasons are the skin around your eyes is actually thinner than most parts of your body. The second reason is that you have smaller sebaceous glands that produce oil in that area, as well as your entire face has the most regular exposure to UV rays, which ultimately break down collagen and elastin. So this is why it is actually really important to address these signs of paraorbital aging, and for those of you who are younger, to help prevent them. So just to be clear, this is what falls under paraorbital aging. The first one is wrinkling around the eyes and crow's feet, which is usually on the outer corners of the eyes. Dark circles under the eyes, sagging or bagging on the eyelids as well as under the eyes, puffiness, and loss of opacity, so there's more translucency. So if you have fairer skin, that might look like more of a reddish brown color, and then for those of you who have darker skin, it's more of a dark brown color. So those are all included in the paraorbital aging that we're going to be talking about today. Before we get started, we do want to ask you to please give us a thumbs up. That helps support our channel, as well as subscribe to our channel and hit that notification bell. So the reason why we're asking you for that is because it does help to support our channel so that it tells us that this is the information that you guys are wanting. Okay, so we're going to go right into our video. So now, paraorbital aging affects different ethnicities and it shows up in different ways. And so the reason why we're going to talk about that is because of the different treatments and prevention. Now, it doesn't mean that when I talk about a specific ethnicity, that just because you are under that ethnicity that you're going to get this, because obviously everyone is an individual, but these are the more commonalities in the ethnicities as far as the appearances of paraorbital aging goes. Okay, so the first one is African Americans. So African Americans, the most common thing seen with paraorbital aging is the drooping of the lateral canthal area. And that is the inner cartilage of the inner eye. So when that starts to droop, the angle in between the outer eyes, it actually starts to narrow. So then it gives the appearance of a drooping of the eyes, ultimately shows the effects of aging. Now, Middle Easterners and Indians, because they typically have darker skin, the signs of paraorbital aging for most of them is paraorbital hyperchromia, and that is dark under eye circles. And the most common things that actually contribute more towards the darkening of the under eye circles is photo damage, so lots of UV ray exposure, as well as inflammation. So for Asians actually in the earlier years of aging, they actually don't see a whole lot of wrinkling and crinkling until the latter stages of their aging. What their biggest struggle is usually hyperpigmentation. So an interesting thing is it's a little bit different with Asians who have primarily a Western diet. So what they have seen is because they eat a higher diet in omega-6 fatty acids and sugar, they see more hyperpigmentation and a little bit more breakdown of collagen and elastin more than their Asians in the Asian country counterparts do. And so their challenge is, first of all, hyperpigmentation and then a breakdown of collagen and elastin. And so their concern with fine lines and wrinkles actually happens the latter part of the aging years. Now, Caucasians, it's actually the complete opposite. They actually see the breakdown of collagen and elastin first before the hyperpigmentation. So for most people who start to see signs of paraorbital aging, it's usually the fine lines and wrinkles, and then later on it's the hyperpigmentation. And for some, it's actually the sagging of the eyelids and bagging under the eyes that is mainly their concern before the hyperpigmentation. So although the commonalities of all the different ethnicities of what causes the breakdown of collagen and elastin and the appearances of paraorbital aging are pretty much the same, which is exposure to UV rays and inflammation and other environmental factors, the uniqueness of each individual's response to the AGEs that causes the breakdown of collagen and collagen retention obviously varies. Okay, so the first one we're going to talk about is crow's feet, or otherwise known as wrinkling around the eyes. And the reason why we're going to talk about the first one, is because that's actually usually the first signs of aging for most people. So the wrinkling of the eyes are actually scars. So what happens is breakdown of collagen and elastin and tissue, and when you make repeated facial expressions like smiling or frowning or squinting, when the collagen and elastin breaks down, the skin is not as stretchy or elastic. And so those wrinkles are basically scars of your skin attempting to heal with the repeated crinkling of the skin. And sagging usually taking place starts usually at the inner corners of the eyelids and then progresses outwards. That's also the cause of that is loss of elasticity. Now you may be thinking that there is some fancy eye cream or eye gel out there that is going to help that. So, and there is. I'm going to tell you about a pro tip of that. But the first line of defense is basically the UV ray exposure. You need to wear sunscreen because basically that is what breaks down the tender, very thin, the collagen and elastin that helps the elasticity around that thin skin. Now, the other extra line of defense is using an eye product and or serum that has antioxidants and peptides to help increase your skin's ability to fight back those free radicals, as well as the sunscreen. Now, here comes the pro tip. So most people will use an anti-aging serum or cream and then use just a regular cheap drugstore brand. But there are some sunscreens out there that actually give you an extra layer of protection. Some of them have stem cells, some of them have antioxidants, some of them have both. So you want to look for that because when they formulate those sunscreens with those stem cells and those antioxidants, the pH, they've already tested the efficacy of them already working together because that is its original formulation. Because sometimes, depending on the serums that you're using or the eye creams or eye gels, when you mix it with a regular sunscreen, it may neutralize the effects of that. This is an actually excellent sunscreen, and they have two formulations. They have that in hydrating as well as oil-free. So this one is Lyra Clinical, and this is the hydrating formulation. And the reason why I like this one is it has the peptide technology, so that's the first one. It has the mineral technology as well as plant stem cells, vitamin C, and arbutin, which is a plant-based lightener and brightener. So for those of you who are struggling with dark circles or hyperpigmentation or age spot, this is great for that. The other thing I like about it is the active ingredient is 21% zinc oxide. Okay, so it is a mineral-based sunscreen. So here is another pro tip, is that if you are using AHAs, whether it's glycolic acid, lactic acid, anything with retinoids, so Retin A or retinol, or even vitamin C serum, when you're using a chemical-based sunscreen, it tends to sting and it can react to your skin. because it's zinc oxide, this is what's great about zinc oxide. First of all, it's mineral and it is light reflecting. So for those of you who have dark circles under your eyes, it actually helps reflect away from the appearance of the dark circles. And if you are using any AHAs or any additional anti-aging ingredients, this actually helps control the inflammation that it could cause, because zinc oxide is naturally an anti-inflammatory ingredient. So this is a little bit more costly than regular sunscreens, but I do think it's worth it, and once people try it, they do love it. So I will put a link below to this product description as well. Okay, so the next one is eye sagginess and eye bags. So that could be sagging of the eyelids or under eye bags. And basically what that is leaking of the fluids in the surrounding tissues around the eyes. And typically that is related to inflammation in the skin, or, you know, underneath the skin. For those of you whose challenge is puffiness, whether it's of the face or of the eyes, get one of those pillows that slightly raises your head so that the excess fluid drains down. And the reason why you want to do that is because when you have extra puffiness and swelling, that is a sign of inflammation. And the more inflammation that you have, the faster your skin starts to age and break down that collagen and elastin. So typically bagging of the eyes or under eye bags are related to periorbital aging. But for those of you who are younger, it may be related to more of your lifestyle. So for example, stress, lack of sleep, allergies, and or diet. Okay, so the next one is dark circles. And although there are some ethnicities that are more prone to the appearance of dark circles, anybody can get this. What leads to that is thinning of the skin that shows the appearance of blood pooling underneath the eyes. And that could be, again, diet, lack of sleep, and allergies. Any of these factors can bring on the inflammation of widening of the blood vessels, which then can increase the appearance of dark circles. Okay, so if you have dark circles or puffiness, here comes the treatments and things that you need to look for in products. So the first one is caffeine. Believe it or not, in some of the eye products and eye gels, you will see caffeine as an ingredient. And the reason why is because caffeine obviously increases blood circulation and stimulation. So what that does is it actually helps prevent the pooling of the blood underneath the eyes, helping alleviate the appearance of dark circles under the eyes. So it's not enough just to use something that is going to help alleviate it. You want to use antioxidants and peptides because it is going to prevent or prevent further damage. So we're going to talk about what you're going to look for as far as ingredients go to address these signs of periorbital aging. So as far as peptides go, you want to look for dipeptide and palmitoyl tripeptide. So they help reduce under eye bag volume by decreasing capillary permeability. It also increases lymphatic circulation, and ultimately it helps increase the firmness and elasticity on the skin under the eyes. And the next ingredient is hesperidin methyl chalcone. What? Hesperidin methyl chalcone. That is a derivative of a flavonoid that is found in citrus fruits, namely in grapefruits and oranges, and it basically helps with dark under eye circles. And here's one specifically for puffiness and dark pigmentation or dark circles under the eye. The next one is called N-hydroxysuccinimide, or otherwise known as Cricin. So this actually reduces dark circles by 19%, and it actually eliminates the blood-originated pigments that actually causes the dark under eye circles, and also helps with local area puffiness. Now, if your issue is puffiness, the ingredient that you want to find in your eye gel or eye cream is glycine soja protein. This ingredient actually helps improve the microcirculation and integrity of the collagen and elastin bundle, so that's why it really alleviates under eye puffiness. Now, pay attention. For those of you who have fine lines and wrinkles and you are using a retinoic acid-based product such as Retin A or Retinol, listen to this very carefully. These peptides actually increase retinoic type activity without the inflammation. So the first one is palmitoyl tripeptide. So that one basically increases collagen and elastin production, very similar to how Retin A or Retinol products do that, but without any of the irritation and the flakiness, and most importantly, none of the inflammation. If you have the number 11 lines, those are the vertical lines in between your brows, then you're going to look for the peptide called acetohexapeptide. That helps with the lines in between the brows because those lines typically are deeper than the fine lines and wrinkles that are around your eyes. Now, don't forget, in addition to the antioxidants and the peptides, you have to use ingredients that are humectant, that actually draw moisture from the environment and binds it to your skin. Because if you don't have moisture in your skin, all of those antioxidants and peptides don't help because it can thin the skin. So a good ingredient to look for is sodium hyaluronate, and that is hyaluronic acid. And you cannot react to this because your own body makes this ingredient. It's in the vertebrae, in the gels in between your vertebrae, it's around your organs, and it acts as a lubricant in between your joints. So I would recommend getting a hyaluronic acid serum that is not blended with any other creams, lotions, or antioxidant serums, because when you're using so many products around your eyes can react because it can be more sensitive. So make sure you use hyaluronic acid serum to increase the moisture abilities in your skin. And if you're not sure about whether to use an eye cream or an eye gel, please click on our video. We actually have that. So see you in the next video, and thank you for watching.